If you're living with diabetes and still wondering why your blood sugar feels stubborn despite everything you're doing right, listen closely. Many doctors quietly check one specific vitamin first when patients complain of fatigue, nerve pain, or numbers that won't come down. The surprising reality? A deficiency in this vitamin can make insulin work less efficiently, speed up complications, and silently push A1C higher, even when carbs and meds are perfectly managed. So here's the big question. Could correcting this one vitamin be the missing piece that finally helps lower your blood sugar and A1C? In today's video, we're counting down the top 5 vitamins for diabetics that lower blood sugar, backed by research and recommended by doctors. Stay with me until the end, because the number one might shock you. Let's dive in. Number 1. Vitamin B12. Vitamin B12, especially in its active methylcobalamin form, is one of the most critical vitamins for diabetics that lowers blood sugar indirectly by protecting nerves, improving energy metabolism, and supporting healthy insulin sensitivity. Many people with type 2 diabetes, particularly those on metformin for years, develop B12 deficiency because the medication can reduce absorption by 30 to 40% in the gut over time, leading to levels that drop without obvious symptoms at first. Without adequate B12, diabetics often experience unexplained extreme fatigue that sleep doesn't fix, tingling or burning sensations in hands and feet, neuropathy, brain fog, memory issues, mood changes, and even worsening insulin resistance as homocysteine levels rise. Clinical studies show that correcting B12 deficiency with supplementation can reduce HbA1c by 0.5 to 1.2 percentage points, lower fasting blood glucose significantly, dramatically ease diabetic neuropathy pain within months, and reduce cardiovascular risk by lowering harmful homocysteine. It's especially important for nerve regeneration and red blood cell formation, both commonly affected in diabetes. Take 1,000 to 5,000 micrograms of methylcobalamin daily, sublingual tablets, lozenges, or injections for best absorption, bypassing gut issues. Food sources include meat, fish, eggs, and fortified foods, but supplementation is often needed. Side effects are extremely rare, even at higher doses. Number 2. Vitamin D3. Vitamin D3 is a powerhouse vitamin for diabetics that lowers blood sugar by directly improving insulin production in the pancreas, increasing insulin sensitivity in muscle and fat cells, and reducing systemic inflammation. Shockingly, up to 80 to 90% of people with type 2 diabetes are deficient in vitamin D, especially those with darker skin, limited sun exposure, or living in northern climates. Low vitamin D levels are strongly linked to higher fasting glucose, greater insulin resistance, increased risk of complications like heart disease and neuropathy, and poorer beta cell function. Multiple large-scale trials show that correcting deficiency with vitamin D3 supplementation can reduce HbA1c by 0.4 to 1.0 percentage points, lower fasting blood sugar by 10 to 20 milligrams per deciliter, improve insulin secretion, and enhance overall metabolic control. It also supports immune function, bone health, and mood, areas often impacted by diabetes. Aim for 2,000 to 5,000 international units of vitamin D3 daily, taken with a meal containing fat for better absorption. Get your blood levels tested first. Target 40 to 60 nanograms per milliliter, and recheck every 3 to 6 months. Sun exposure and fatty fish help, but supplementation is usually necessary. Side effects are rare at recommended doses. Number 3. Magnesium, glycinate or citrate form. Magnesium is an essential mineral, often highlighted as a vitamin-like nutrient in diabetes care, that over 60% of diabetics are deficient in, yet it's required by more than 300 enzymes involved in glucose metabolism, insulin signaling, and energy production. Low magnesium makes cells less responsive to insulin and worsens blood pressure control. Deficiency symptoms include muscle cramps, fatigue, irregular heartbeat, and heightened insulin resistance that drives up blood sugar and A1C. Correcting magnesium levels has been shown in numerous studies to lower fasting blood sugar by 10 to 20 milligrams per deciliter, reduce HbA1c by 0.5 to 1.0 percentage points, decrease muscle cramps and fatigue dramatically, and protect the heart and kidneys from diabetes-related damage. It also helps relax blood vessels and improve sleep quality. Take 300 to 400 milligrams of magnesium glycinate or citrate daily in divided doses. These forms are gentle on the stomach. Food sources include leafy greens, nuts, and seeds, but supplementation is often needed due to soil depletion. Side effects like loose stools can occur with oxide forms. Stick to chelated versions. Number 4. Vitamin C. Vitamin C is a powerful water-soluble antioxidant vitamin for diabetics that lowers blood sugar by combating oxidative stress and inflammation caused by chronic high glucose levels. People with diabetes use up vitamin C 2 to 3 times faster than others and typically have 30 to 50% lower blood levels, leaving cells vulnerable. Deficiency contributes to poor wound healing, frequent infections, gum problems, higher cardiovascular risk, and worsening insulin resistance. Clinical research shows that supplementing with 500 to 1,000 milligrams of vitamin C daily can lower fasting blood glucose, reduce post-meal spikes by 20 to 30%, drop HbA1c by 0.4 to 0.8 percentage points over months, and improve endothelial function for better blood vessel health. It also supports collagen production and immune defense. Take 500 to 1,000 milligrams daily in divided or time-release doses to avoid stomach upset. Rich food sources include bell peppers, broccoli, strawberries, and citrus. Side effects are rare below 2,000 milligrams per day. Number 5. Vitamin B1. Benfotiamine, a highly bioavailable fat-soluble form of vitamin B1, thiamine, tops the list as the absolute number 1 vitamin for diabetics that lowers blood sugar and prevents complications. Regular water-soluble thiamine is poorly absorbed, but benfotiamine is absorbed up to 5 times better and directly blocks 3 major biochemical pathways: AGEs, PKC, and hexosamine, responsible for diabetic nerve, kidney, eye, and vascular damage. Many diabetics are functionally deficient in active B1, even when standard tests appear normal, leading to neuropathy pain, kidney dysfunction, retinopathy progression, and cardiovascular issues. Large clinical trials show benfotiamine at 300 to 600 milligrams daily can significantly reduce HbA1c, dramatically ease neuropathy pain and burning within weeks, protect kidney filtration, improve endothelial function, and slow retinopathy, benefits doctors call remarkable for a single nutrient. It's often called the forgotten vitamin because its effects are so targeted to diabetes pathology. Take 300 to 600 milligrams daily in divided doses with meals for optimal absorption. Food sources of thiamine include whole grains and pork, but benfotiamine supplementation provides superior protection. Side effects are virtually non-existent, even at higher doses. Managing diabetes isn't just about carbs and insulin, it's about giving your body the key vitamins it's burning through faster than most people realize. Vitamin B12, D3, magnesium, C, and especially benfotiamine offer real, doctor-recommended support for lowering blood sugar, protecting nerves and organs, and improving A1C naturally. If this video helped you discover the number 1 vitamin for diabetics that lowers blood sugar, give it a like to help others, subscribe for more practical, evidence-based tips, and drop a comment. Which of these vitamins are you checking or adding first? Your story could encourage someone else on their journey. Stay strong and take control.